Well, it is 7:43. We are at the confluence of a bunch of seasons. We got spring allergy season underway, and yet this is happening at the same time that flu season, still here, by the way, late in it. And then you've got another rise in COVID cases, and then you've always got those colds that are going around all of the time of the year. 4 different concerns and a lot of overlapping symptoms. So how can you tell one from the other? Here to break that all down and to talk about treatments is Dr. Frank Contacessa with Northwell Health Physician Partners in New York. He is no stranger to the show. Dr. Frank, good morning. How are you today?
Morning, Tim. Doing fine. How you doing?
Well, I'm doing all right. My voice is probably better now than it's been at any point during the week because I've had a cold that I've been getting over. At least I'm fairly certain it's a cold with a sore throat, things like that. But why don't we just start by talking about how difficult it is that we've got 4 different problems with those overlapping symptoms to be able to tell what's what?
Sure. This is a tough time of year. You know, we're just starting up with seasonal allergies. Within a week or two, the trees will be blooming. And those people with spring tree allergies, which is extremely common, will start to be getting the runny nose, postnasal drip, dry cough that you see with some of the other things like the Omicron strain of COVID. The earlier strains of COVID, Delta and the Alpha and the native strain, looked more like the flu. You had high fever, aches, chills. And that's how you can kind of separate the flu out. When you wake up and you feel like you got hit by a truck and you literally can't get out of bed, at this time it's probably the flu because the Omicron strain of COVID looks more like a common cold these days. You have postnasal drip, sinus congestion. The earlier strains were hitting the lungs. You're getting pneumonias. Now we're getting post-COVID sinus infections. Same kind of symptoms you get with seasonal allergies. So how do you tell the difference? So first of all, again, with the flu, you're going to get high fever, aches and chills, the hit by a truck feeling. But the Omicron COVID looks just like a cold. I had a patient yesterday. Josh, she said, I think I just have a regular old cold. She turned out to have COVID.
Yeah.
So it's not as easy to separate out these days. So if you have any doubt, if you have cold-like symptoms, it's not a bad idea to do a home test, even though they're sort of limited use. They can come in handy when you just have a plain old cold and you're not sure if you should waste a trip to the doctor.
And I'm glad you went through sort of that change in symptoms as the coronavirus has itself changed. And that, of course, applies to BA2, which is like the brother or sister of BA1, which was what we knew as Omicron. I wanted to ask about the likelihood of fever. Has that changed with regards to COVID as it has sort of moved its way from the lungs up to the upper nasal tracts?
That's a good question, Tim. And yes, the answer is yes, we have seen a change. The earlier strain, you did see higher fever, those aches and chills that you sort of see with the flu. By the way, flu season is really kind of winding down. I haven't had a case of flu in the last few weeks. It's still out there, but we're seeing a lot less of it. But yeah, this BA2, which is dominant now, just within the last few weeks, the BA2 strain has become pretty much the predominant strain. Not to be afraid of that, by the way. It's still causing very mild illness, really nothing to be afraid of. I haven't put anybody in the hospital with COVID in probably a month or 2.
Yes, which is good to see, and hopefully it's going to continue that evolution to become a little less severe as things go on. Dr. Frank, thank you so much. Boy, you nailed it. All those different things we need to look out for. It's interesting to think that the flu might be the easiest thing to tease out of the other 3. Thank you so much for your time again, and I'm sure we'll be talking to you again soon.